Hello, I'm Dr. Rob Lindsey, and I'm with Vallejo Health and Wellness Center. And if you're watching this video today, this is a video that really is about diabetes. And the title of this is what your doctor may not be telling you about diabetes. Just a little bit about some things that we commonly hear in the office. People come in, and this is what we've heard. This is what people have heard from other doctors, is that it's incurable. Or they'll come in and they'll say, well, doc, I know that this is progressive, meaning it's just going to get worse and worse and worse. Or they'll come in and they'll say, it's hopeless. There's no hope. There's nothing that I can do that is going to make my diabetes any better. And so people have just really been left with the idea that they're just going to have to be on some kind of a drug for the rest of their life. Well, just a little bit about myself here, and then we'll get into this subject here. I'm Dr. Rob Lindsey, as I said, and I'm a chiropractor. I'm a doctor of chiropractic. I also have a master's degree in sports medicine. So I've been on both sides of the healthcare spectrum, in the allopathic world, working with orthopedic surgeons and with physical therapists. And then, of course, in the alternative or complementary healthcare world as a chiropractor. Now, I'm a graduate of the American Functional Neurology Institute, and I've got hundreds and hundreds of postgraduate study in functional endocrinology, functional neurology, functional blood chemistry analysis. Another thing is that I have the privilege of being able to consult with 350 to 400 doctors who also practice functional medicine. They're all over the country, so we can help you. That's the beauty behind this. Now, here's the problem, okay, when we talk about diabetes, and this comes from the Institute for Functional Medicine, and it says here that a rapidly spreading epidemic of chronic disease has compromised the effectiveness of our healthcare system and threatens to bankrupt both national and global economics. Okay? Alarming projections suggest that future generations may have shorter, less healthy lives if current healthcare conditions continue the way they're supposed to, unchecked. It says our current healthcare model fails to confront both the causes of and solutions, okay, for chronic disease, and must be replaced with a model of comprehensive care that is geared to effectively treating and reversing this escalating crisis. Okay, so they're talking about getting to the causes and the solutions, not just covering with drugs. That is where we need to go to today. Now, here's some statistics, okay? We have never been sicker in our country, frankly. We've never been sicker. Okay, 1 out of every 2 people that are watching this video right now are going to die from heart disease. All right? If you're married, the statistics show that you or your spouse. The second thing is 1 in every 2 will develop some form of cancer. 1 in 3 will develop diabetes. 1 in 8 actually suffer from migraine headaches. 1 in 3 women are clinically depressed. 1 in 6 couples are infertile. 1 in 6 kids have neurologic condition of some kind. 1 in 8 people have an autoimmune condition. And 1 in 8 women have a thyroid problem. These are all chronic diseases, including diabetes. We literally have never been sicker. And yet, look at this. The World Health Organization, all right, the WHO, they have studied over 100 healthcare systems of the major industrialized countries all over the world. Okay, we rank number 1 in crisis care in the U.S. Okay, that's fantastic. Okay, we have the best emergency medical care in the world, right? If I get in a car accident, if I break a leg, if I'm on a heart attack, we are excellent. But here's the bad news. In 1997, the USA, we ranked 34th in healthcare. All right? In 2000, we ranked 37th. Are we trending in the right direction? No. In 2007, we ranked 48th. Not the direction we want to go. And in 2009, we ranked 50th. And the USA ranked number 41 in life expectancy. Why is this happening, folks? Listen, we spend more on healthcare than any other country in the world. And we have the worst health of any of the industrialized nations. Why aren't we number 1? Something's wrong. Something absolutely is wrong. Look, our current healthcare system, okay, in the U.S. we spend more than $2.3 trillion in 2008 on healthcare. That's more than 3 times the $714 billion spent in 1990 and more than 8 times the $253 billion that was spent in 1980. And diabetes plays a major role in these healthcare costs. Well, really, what are the costs of diabetes, okay? Well, the National Institute of Health spends about $1.037 billion on diabetes research. And in 2007, the total cost attributable to diabetes for Americans, just in America, is estimated at $174 billion with a B. It's an increase of 32% since 2002. This is your tax dollars, hard at work, doing research. I'm going to tell you right now, the research is not going to find a cure, because the cure is not in a drug, and that's what they're researching. So what is diabetes? What is this thing that we're dealing with here? Well, we can call it a chronic metabolic disorder. See, the body cannot metabolize carbohydrates, fats, and proteins because of a lack of or ineffective use of the hormone insulin. All right? Now, it's classified into 3 primary types that share some of the symptoms, same symptoms, and complications of what's called hyperglycemia or high blood glucose. It's bad to live with, and it's a horrible way to die. Okay, and there's a lot that you can do to prevent or help it. So what is it again? Well, 23.6 million people, okay, have diabetes in our country. 17.9 million people have been diagnosed, but 5.7 million people, they say, at least, are undiagnosed with diabetes. So their bodies are falling apart, and they don't know it. They haven't been told you have diabetes. So why is this happening? Well, here's the issue here. Most chronic disease is actually preventable, all right? Much of it is reversible, but it is really about our choices, okay? Healthy choices equals healthy life. Now, there is a genetic component, okay? But mostly it's due to your diet, to nutrition, to environmental exposures, to stress, to exercise or lack of, and to spiritual needs. So if you don't make good choices in any of these categories, it doesn't matter what your genetics are, okay, your body's not going to work right. It's going to begin to deteriorate over time. Now, this is what you need to do. This is important. And I know you can't maybe see this whole slide here, but all chronic health conditions have some very common threads. And so I don't care what we call them, whether it's diabetes or a thyroid issue, whether it's fibromyalgia, whether it's insomnia, irritable bowel disease, whether it is infertility or ADD, okay, they all have some common threads. And those common threads include blood sugar and insulin imbalances, of course, adrenal problems, adrenal glands, immune system. We might also say autoimmunity, or the immune system's attacking its own body. Anemia, that's a big one. Thyroid dysfunction, liver and GI, or gastrointestinal problems. Fatty acid metabolism, which is how you actually break down those fish oils you're told are so good for you. Hormone problems. And then, lastly, and this is hardly ever looked at by anybody, poor brain or neurotransmitter function. So these are common threads that we can find in diabetes and virtually any other health problem. Now, what we're going to do here is in the next few minutes is we're going to talk about something about diabetes and what are the contributing factors here, okay? And what I want you to do, if you have a piece of paper, is go ahead and just pause the video right now and just grab a piece of paper and right in the very middle of it, draw a circle and put diabetes right in there, okay? Diabetes. And what I want you to write at the top of your page is this: web of physiologic dysfunction. And what does that mean? What I'm here to tell you is that it is an absolute impossibility. It's physiologic impossible for you to just have diabetes. I'll say it again. It's impossible for you just to have a blood sugar control problem like diabetes. What you are suffering from is a web of physiologic dysfunction. It's a tangled web. We need to try to untangle it in order to fix you, okay? So we've got diabetes in the middle. And here is what this thing looks like. What we're talking about here are all the different pieces that contribute to diabetes. Up here we've got blood sugar imbalance, of course. We've got adrenal dysfunction. We've got gut dysfunction, immune system, cellular dysfunction. all of these little pieces of the puzzle, and it is a puzzle, have to be figured out. Now, in our office we use a form called the Neurologic Assessment form, and I know you don't have that with you, but it helps us to find out if you have a brain-based component, all right? Now, when it comes to the brain, it really depends on what type of brain problem you have, because there are different lobes of the brain. As you'll see on this picture here, we've got the frontal lobe right up here. We've got the parietal lobe up in this area of the brain. We've got the temporal lobe on the side. We've got the occipital lobe in the back. And we have the cerebellum, which is in the back of the brain. Now, each of these has their own components and what they do. As an example here, the frontal lobe is about executive function, all right? It's about judgment, planning, cognition. It's about large motor movement. It's about your ability to be able to just to function in everyday life, to think clearly. The parietal lobe is where we feel stuff. If somebody touches your leg, you feel it. If you feel vibration because you're driving in the car on a bumpy road, that's because your parietal lobe feels that. Your temporal lobe, this is a biggie, because if you suffer from short-term memory issues or sleep problems, that's temporal lobe in many cases. Occipital lobe in the back, that's where you have vision, all right? And the cerebellum, this is a big one. This is where you have your balance, your coordination, eye movements, accuracy, and it is a relay from the body to every other lobe of the brain. So if the cerebellum isn't working well, guess what? You're not going to work well. So in order to figure out how to fix diabetes, we have to first find out, do you have a brain-based problem that's part of it? How? You do a full neurologic exam. Now, let's go on a little bit further here. We've got diabetes in the middle of our piece of paper here. And so now we want you to draw a line and put up to the right of diabetes, I want you to write brain. Just write brain in there with a circle, okay? Because if you have a brain problem, there's no way we're going to fix diabetes. Now, how do you know if you have a brain problem? Well, what about this? Have you ever walked into a room and forgot why? Have you ever walked out of Walmart and forgot where you parked your car or where you've left your keys? All right? These are temporal lobe problems, in part. How about this? Your spouse has said, wow, you're not the same person that I married 20 years ago. Well, that could be a frontal lobe problem. You've had a personality change. How about this one? You feel things that you shouldn't feel. Like it feels like restless legs. You feel like you've got ants crawling up your legs. Or you've got what we call neuropathy, where you can't feel the bottom of your feet very well. Okay, these things have to do with your brain. Well, in order to maximize your health and get you better and get diabetes improved, you have to fix the brain. How many of your doctors have looked at this? I'm going to bet that none have. Let's keep going. How are you going to check this? With proper testing. You need a complete functional neurologic exam. Now look at this. Here's a picture of normal brain function. And the way this works is that as long as the cerebellum, which is in the back of the brain, okay, is receiving the proper amount of nerve input from the body, all right, there will be sufficient signaling to the opposite frontal lobe. So the right cerebellum should fire to the left frontal lobe. Then the left frontal lobe should fire down to the lower brainstem, and the lower brainstem should fire up into the midbrain. Okay? And it should put the brakes on. So the brain will be able to send sufficient signals to the lower brainstem, which will keep the midbrain from overfiring. This is normal, this is healthy. Well, let's look at an abnormal brain function. If one side of the cerebellum, this one, is not receiving the proper input, nerve input, it cannot send the proper amount of signal to the frontal lobe. Now, the frontal lobe cannot send the proper amount of nerve messages to the lower brainstem, and you will not be able to keep the upper brainstem or the midbrain from overfiring. Instead of having the brakes on, the gas pedal's on. People who have this issue, they cannot go to sleep or stay asleep. Okay? They've got chronic fatigue, they've got chronic pain. Does this fit with you at all? So we've got to find out if you've got a brain problem. Your midbrain is overfiring. Now, there's another form that we use in the office. It's called the Metabolic Assessment form, and it looks at all the different categories of all the different organs. I know you don't have that in front of you, but we look at each one of these and it helps us to determine which systems aren't working good. So what type of organ problem do you have? That's going to be important to know, because as I said, with diabetes you don't just have a blood sugar problem. So in addition to having a brain problem, there's a good chance that you also have a colon problem. What's the colon? The colon is your large intestine. It's part of your digestive system, okay? If you're somebody who has constipation or diarrhea, or you alternate back and forth, okay, those are signs of a colon problem. And what I want to know is, how many doctors have you been to that have addressed your brain problem and your colon problem? My guess is you're going to say none. They've probably never looked at this. The only thing they've looked at is your blood sugar, and then they've given you metformin, a drug. How is that going to fix a brain problem? It's not. See, if you have chronic disease, diabetes, that's being caused by a brain problem and a colon problem, what do you think your results are going to be of trying to treat that? Not too good, right? Right. All right, so let's keep going here. The next category that we want to think about here is the stomach. Well, how do you know if you have a stomach problem? We use the Metabolic Assessment form, but here's a couple of keys. You ever get belching, burping, or bloating after you eat? Or perhaps you feel like you've got acid reflux, GERD, you have a sense of fullness after meals, or you need some sort of antacid, Tums, Prilosec after you eat. Well, guess what? You've got a stomach problem. Now the stomach is really important. And how many doctors have you been to that have addressed the brain, the colon, and the stomach in relation to your diabetes? Answer, 0. That's right, because they don't look at this. Let's keep going here. How about the small intestine? Wow, this is a huge piece. We could talk all day long just about the small intestine, right? Now look at this. This is critically important, the small intestine, because this is where 90% of your food is broken down and assimilated in your body. And food is your fuel source for healing. All right? Now here's something else you probably didn't know about the small intestine, is that the small intestine, about 90% of your serotonin is made in your small intestine. That's what makes you feel good about yourself. Now on your sheet of paper, you should have written in a colon, a stomach, and a small intestine. And what I want you to do now is to draw a circle around that, kind of link those together, because from here on out, what we're going to call that section is the gut. We're going to call it the gut. Right now, the gut is so important, because as I said, we've got 90% of our serotonin is made there, but also 80% of your immune system is in your gut, particularly your small intestine. Well, if you've got an immune problem, it started in the gut, that's not ever gone after, how in the world are you ever going to fix diabetes? You're not, right? Now, what I want you to do now on your piece of paper is to draw a link, draw an arrow, a two-way arrow from the brain to the gut. Why? It's what we call the gut-brain connection. Tons of research about this intimate connection between the brain and the gut. Partly why when you are nervous about something, you feel butterflies in your stomach, or you have this adrenaline rush, okay? It's because you're feeling that emotion in your gut. That's that link to the brain. Now look at this. Immune response in your body, when you have an immune response, it can lead to something called a leaky gut. And a leaky gut leads to a brain disorder. See, when the brain membrane breaks down, the protective shield along the brain is gone. And neurotoxins can pass through freely. And then these microglial cells, okay, they attack to destroy the toxins, but then there's collateral damage in the brain. So this starts in the gut, folks, with what you eat, and critters like bacteria and viruses and parasites that come in on your food, and they get into that gut and they cause an inflammation, they cause an immune reaction in the gut. Remember, 80% of your immune system is in the gut. So you start to get a jacked up immune system. Those inflammatory proteins cross into the bloodstream, and now they have carte blanche to go wherever they want, into the brain, to the rest of the body, and they cause inflammation. Guess what? Inflammation is going to contribute to your inability to heal from diabetes. So, how important do you think this gut is? My goodness, we could go on this for a whole weekend. Really important. So bad gut equals bad brain. How well is your gut and your body going to heal, okay, when 80% of your immune system is in your gut and you've got a gut that's not working properly? How well is it going to heal? Then how in the world are you going to heal from diabetes with that? You're not. So, you've got to look at this. Look at this. This is a picture that shows the link between autoimmunity, body attacking its own tissues, and leaky gut. And without going into great detail, we've got things that can contribute, like you get increase in antibodies. When you take drugs and antibiotics, it can lead to leaky gut. When you have physical stress, it can lead to leaky gut. Infections, enzymes, when these things are out of balance, it breaks down through this really good, nice, tight gut barrier. You've got intestinal barrier dysfunction, food allergies and intolerance develop, you get immune system abnormalities, and then you have autoimmunity, and this influences the blood-brain barrier. Again, we've got to look at the brain, we've got to look at the gut if you want to fix diabetes. I hope this is making sense so far. Let's keep going here, because what we're going to go to next is some other things really quick about leaky gut. That things that can lead to leaky gut or bad gut function are gluten intolerance or allergies to gluten, or other foods like milk and eggs and soy and other grains. That's why you may have to get on a very strict diet to fix your diabetes. Other things that can contribute to this are gut infections, okay? Parasites, for example, yeast infections, bacterial infections, mold. If you have these and they're not fixed, they're not killed, it's going to be hard to fix diabetes. So you need to, in some cases, run a stool sample. Okay, the next section we're going to talk about here, it actually comes down to blood sugar. Now this is important for you. If your blood sugar is not between 85 and 99, if you're above that or below that, okay, then you have a blood sugar problem. This is normal, healthy, functional range. Functional means optimal. It means healthy range. All right? Most, most MDs say that as long as your blood sugar is above 65, then you're fine. That's not true. Okay? It's got to be between 85 and 99. Some folks, though, are doing this. They're up and down all day long. They've got what we call dysglycemia, which means they've got bad blood sugar control all day long. They've got blood sugar spiking, they've got insulin spiking, and then they both dip all day long. Highly inflammatory in the body. That process has got to be stopped in its tracks. How do you figure out what your blood sugar is doing? You need proper testing. Not just an A1C or glucose, but we also look at your full lipid panel and lactic acid dehydrogenase to find out what's happening with your blood sugar control. Okay, so all these things so far are contributors to diabetes. We're going to keep moving here now. We're going to talk about the adrenal glands. This is really important. The adrenal glands are small little glands. They sit on top of your kidneys, but they're powerful because they release several hormones. The two I want to talk about are cortisol and epinephrine. Now, cortisol. Cortisol is, you might call it your fight or flight hormone. If you're about to get hit by a bus, cortisol gets spilled into your bloodstream so that you can run away from that bus right now. If that didn't happen, you would get run over. You would die. Cortisol is there for a reason. It's meant for short-term survival. But if it's left unchecked, always going over and over and over because of chronic stress, it's going to lead to problems. Okay, it leads to leaky gut. It leads to poor thyroid function. It leads to poor blood sugar control, and contributes to diabetes. It'll affect your immune system. It will affect your short-term memory. Okay? The other one is epinephrine. Epinephrine, also known as adrenaline. Epinephrine, if it's released over and over and over, it leads to chronic pain because it bathes pain fibers. So if you have diabetes and you have chronic pain issues, you probably have an epinephrine problem. Too much of it being released over and over because of stress in the body. Okay, so cortisol has to do with short-term memory. I can't remember things. Epinephrine has to do with pain all over, pain throughout the body. How do you figure this out? You need proper testing. You need to do an adrenal saliva test to find out what your cortisol is doing. All right, look at this picture here. This doctor says, good news, all of your tests are negative. And the patient's sitting here saying, well, how can that be? I'm always tired, fatigued, no energy, okay? I've got headaches, I can't lose any weight. Is this what you feel? Is this what you have been told? Your lab tests are normal? Or you simply have diabetes? It's not true, folks. There's other things at play here. So, let's go back to our picture here. So far, we have this web of physiologic dysfunction. Brain, gut, blood sugar, adrenals. And the last piece I want to bring in here is thyroid. This is so important. The thyroid is so important because the thyroid gland has, there are receptors on every single cell in your body that receive thyroid hormone. And thyroid hormone is what drives metabolism. It's what drives the inner engine of all these cells to work. So if your thyroid is sluggish, you will have constipation. Your hair will fall out. You'll lose the outer third of your eyebrows. You will not be able to lose weight even though you're on a low-calorie diet and you're exercising like crazy. You'll be depressed. Many people that I see that have diabetes, they have an undiagnosed thyroid problem because the doctors never ran the right tests. And there's a lot of them. We run a series of 9 or 10 different tests to find out what is the cause of this. Where's the thyroid problem at? Okay? You've got to get the proper testing. So folks, just as a recap, you can't just suffer from diabetes. You are suffering from a web of physiologic dysfunction. And you need somebody who is willing and able to dig and untangle that web, to untangle it. Now you've sat here and you've watched this for the last 20 or 30 minutes. Knowledge is great, okay? Wisdom, great. But knowledge without action is useless, all right? Don't just sit there and not do something about this and go, well, I'm just going to have to go on with my life the way it is. There are things that can be done. But I'm going to tell you that you cannot drug your way back to health. You can't. It won't work. There's never been one drug that has shown to provide a nutrient that a body needs for survival. Drugs only cover symptoms. They never treat causes. You can't drug your way back to health. So, here you are. You've been listening, you've been watching, you've been attentive. Hopefully you've taken some notes. And here you are, you're sitting there. And I'm here to tell you that even if you're on the right track, you will get run over if you just sit there. Don't just sit there. Okay, if this makes sense to you and you want to find out if we can help you, then you need to call our office, Vallejo Health and Wellness Center. We're in Eden Prairie, Minnesota. And the number is 952-949-0676. Okay, we will do what it takes to dig, find the causes, remove the causes, and help you. I hope you have a great day. I hope you enjoyed this, and we look forward to hearing from you. Again, 952-949-0676. Have a great day.